Hi, everybody. Dr. Stu Hoffman, president of ChiroSecure. And the class we're going to have today is on informed consent to care. There are so many doctors as I go around the country lecturing that still do not incorporate an informed consent into their practice. And some doctors use things that they're calling an informed consent, but actually are not. So we're going to talk a little bit about it today and how it affects your practice, your patients, and your safety as well. So I want to start with, where did informed consent even come from? Well, in the medical world, patients were fed up of not being given information to make informed choices. So the informed consent doctrine stems from the concept that patients have the right to control their body and what happens to it. Therefore, to be in control, they have the absolute right to be informed about the proposed care and the risks that are associated with it. The opinion of the Association of Chiropractic Colleges, the association believes that when patients receive appropriate information, which would be the informed consent, before undergoing chiropractic care, it will assist them in eliminating misunderstandings. And that's going to be an important theme through this, because the communication between the doctor and the patient is essential. And I actually believe that by utilizing the informed consent, you actually have an opportunity to increase your communication with that patient, gain greater trust, greater understanding, and hopefully a more compliant patient. And I'm going to get more into that as we go. So informed consent requires that the doctor disclose to the patient all significant clinical information that the doctor possesses, which would be the necessary material in order to make a decision by the patient whether or not to undergo the treatment that is being recommended. Informed consent also allows the patient to make an educated decision. Not providing the necessary information deprives the patients of an understanding of what they may reasonably expect from such care, and it does not allow them to understand the inherent risks that they may be taking. Now, we know that with chiropractic care, risks are so minimal, but it's still the whole purpose of informed consent. And it also would impair their fundamental right to make decisions concerning the types of care, if any, that they wish to undertake. So, informed consent is supported by the Association of Chiropractic Colleges, and they recommend that informed consent be obtained before carrying out any diagnostic or therapeutic procedures on any patients. They further recommend that if a certain risk is a mere possibility, which is ordinarily you wouldn't need to disclose that, but yet it still carries serious enough consequences, such as paralysis or death, it should absolutely be regarded as material risk requiring disclosure. And what are they really talking about? They're really talking about the whole stroke issue. The risk is so minimal, but they think that it can be serious enough to put it in that category that it should still be disclosed. Many authors heed this advice and recommend obtaining informed consent prior to performing any chiropractic adjustment. But I want to touch on why it is so important to obtain the consent before you do anything, including diagnostic procedures. We've actually had claims from people that were just becoming patients going through an examination process or a screening process where the doctor may have done a range of motion on the patient or something to that effect, that all of a sudden this patient is now complaining that they have neck pain or headaches ever since the doctor put them through a range of motion. So you always want to get this taken care of on the front end. Well, do you inform the patient or not inform the patient? The challenge with informed consent is that the risk with a chiropractic adjustment causing a dissection and stroke is unknown. So the consent in essence cannot be informed because it's not based on any concrete data. And 10 years ago, 15 years ago, I always said, don't use informed consent. But you know what? Times are different, and we need to go with what is in current literature as well as what will currently protect you as the provider. So David Cassidy, as well as other experts in the field, have concluded that it is not possible to provide an actual informed consent from the patient. In order to provide the consent, the provider must disclose information that is helpful in making an election to do or not to do the treatment recommended. In 2010, I was asked to participate with the state of Connecticut as the Board of Examiners agreed with David Cassidy's conclusion and specifically held that informed consent does not need to be obtained regarding stroke and the risk of manipulative therapy, as they called it. But, you know, it was a bigger issue than just that. At that time, in the state of Connecticut, there were billboards everywhere stating, go to the chiropractor, get a stroke. And, you know, that can concern any and all of us, and rightfully so. But the board, trying to be proactive, took action stating that every chiropractor not only needs to incorporate informed consent, but it absolutely has to have stroke in it. And as much as we are going to talk about having stroke in our informed consent, we do it a little bit different, and I think you'll be very happy to see that. But it is not necessarily something I want our boards to mandate. The medical boards do not mandate specific things in their informed consent. We should not do that either. And in fact, one of the things that I just recently read is that when you go into a hospital for a procedure, what it takes to be in an informed consent in terms of the risk is 1 in 1,000 to 1 in 100,000, where in the chiropractic world, even the association of stroke is 1 in 1 million to 1 in 2 million. It's not even close. So I definitely was opposed to the licensing board taking this action, and I'm thankful that it went down. And since no one has been able to determine the actual risk, even if we provide a consent form based on speculated figures, we still are unable to provide information that is technically useful for the patient to make that decision. So the risks patients are typically informed about is what I'm talking about here. At the hospitals, they have an incidence of 1 in 1,000 to 1 in 10,000. So, you know, what are we really talking about? Informed consent, however, you know, when we are implementing informed consent, the consent might be a consideration about you overcoming your fears. Because when I talk about this around the country, a lot of doctors, I get from them that they're fearful of utilizing an informed consent because they're going to have stroke in it one way or another. And even if it's not stroke, even if it's a broken bone, because our #1 call about actual injuries is broken ribs. So no matter what it is, sometimes doctors are in a fearful mode that if I tell the patient something can go wrong, they're not going to like me. They're not going to come to me. I'm going to lose a patient. I'm going to lose a paycheck. Well, I'm hopeful that you can overcome your fear by utilizing what we've prepared for you. And it'll help build confidence in yourself and with your patient. You know, just think about how numb the general public is to all the commercials that are going on out there every single day with medications. And these medications, the side effects are almost always death. And people are running to their doctors asking for this medication. So when we talk about stroke or heart failure, seizures, anything like that, so what? You know, compared to any other procedure that's going on in the healthcare environment, we're going to top it in terms of safety. So don't ever be fearful from that perspective. I always recommend that you have the informed consent be included with your new patient paperwork. And when the patient fills out all of their other forms, they're going to fill this out. They should read it, sign it. And remember, informed consent is technically not even a form. Informed consent is actually a process. The process of the doctor informing the patient and then acknowledging it through signature. So in the chiropractic model, we can't do things exactly the way it's done in the medical world. So it's more important to have this done at your front desk, and then you're going to review once you're in the office with the patient. And I'll share how to do that. But some of the doctors are concerned, well, what if they ask a question? What about this? Well, no problem. Have your staff be prepared that if anyone asks questions about the informed consent, don't worry about it, Mary. Don't sign that right now. The doctor will review it with you anyway, and you can sign it at that time. That's simple. And if you get 1 out of 100 that actually ask the question, you're going to be pretty much on par with the rest of the chiropractic community. So, check for questions. And then when you go into the room to do your initial consultation with the patient, I like to think that it's easy to say to the patient, Mary, one of the forms that you completed at our front desk is what we call an informed consent, just like you sign in every other doctor's office. We don't want it to be something big deal or different or anything like that. We want them to know that they did this just like they do everywhere else. And Mary, the good thing about our informed consent is that so few things can go wrong under chiropractic care that it makes it easy to review. But we did put a few things in there that have been associated with spinal manipulation, and I use those words intentionally, so that you would be informed. Did you have any questions about the form? No. Great. So let's continue. And then you need to document in your file that you reviewed informed consent, the patient had no questions and wanted to pursue care. And if you have an EMR system, EHR system, then you could easily create a little template that says exactly that. Now, what if they did have questions? If they did, it's always going to be about stroke. So you're going to say to them, Mary, I understand. I've heard the same thing over and over. And let me tell you what is true. What is true is that the current literature disputes all of that. And with our informed consent packet, we include a summary of all of the current literature because I want you to be able to be talking about this fluently with your patients in an educational way so that it's not defensive. And then you can ask the patient, did that answer your question? Yes. Any other questions? No. Great. Let's proceed with care? Yes. And then you would document that you reviewed informed consent. Patient had a question about stroke. You reviewed the current literature. Patient was satisfied and wants to continue on. And that's all that there is to it in terms of that process. So how do you implement an informed consent? Or even if you decide to switch the informed consent that you're utilizing because you'll find maybe that you want to use one that we've developed on your behalf. Well, just simply add it to all of your new patients. And if you want to pick a date to start adding it to all of your current patients, simply print out a spreadsheet of all active patients, leave it at the front desk. As they come in, simply have your staff let the patient know that we're updating our paperwork and we just need you to review and sign. they'll do it. It'll be done. For your active patients, don't worry about all the review process unless they have a question, and then just file it in their file. It's that simple, and then check them off the spreadsheet so you know the people that have already been taken care of and you know the people that you still need to get to. So just be open and informative with them. And, you know, like I said, always be prepared with the facts and research. By having this open dialogue, it can only strengthen the doctor-patient relationship, address the patient concerns in a direct and honest manner, and enhance that positive nature of the chiropractic experience. Ultimately, if a patient voices serious concerns, do not be afraid to politely offer them the option of considering care elsewhere. Usually, this will cause the patient to relax, but if not, perhaps they weren't really ready for care in your office in the first place. And why would you want that? So, you know, just be prepared. And if you're going to use informed consent, as I recommend that you do, I always recommend don't just get one off the internet or something like that. Use a professionally drafted informed consent. We have worked with experienced attorneys, about 5 different ones, as well as chiropractors like Jerry Klum. We've had Bill Esteb help us with some of the language in our informed consent. And we took it from 4 pages down to 1 page so that it's an easy, chiropractic-friendly, patient-friendly form to actually utilize. So I want to share with you just a little bit of the language that we have in our informed consent, because I think that it will make you feel empowered to actually utilize it. So I'm going to start off with this part of it. Results are not guaranteed. It is important that you understand, as with all healthcare approaches, results are not guaranteed and there is no promise of cure. That's important because your board requires that of you. As with all types of healthcare interventions, there are some risks to care, including but not limited to muscle spasms, aggravating and/or temporary increase in symptoms, lack of improvement, burns and/or scarring from electric stimulation or from hot or cold therapies if you utilize that within your practice. Fractures, I mentioned that earlier. The #1 injury call we receive is about broken ribs. Disc injuries, strokes, dislocations, strains, and sprains. Now, one of the reasons that I had a hard time with this at the beginning is I felt like, and I think a lot of you would agree, that if we have stroke in there as one of the possibilities that can take place, isn't that an admission that we cause strokes? So I didn't want to just leave it there. So we went on. And it continues to say, the best scientific evidence supports the understanding that a chiropractic adjustment does not cause a dissection in a normal, healthy artery. And there is no study to prove that. So with respect to strokes, there is a rare but serious condition known as arterial dissection that typically is caused by a tear in the inner layer of the artery that may cause the development of a thrombus with the potential to lead to stroke. Now, this is critical. Disease processes, genetic disorders, medications, vessel abnormalities may all cause an artery to be more susceptible to dissection. Strokes caused by these dissections have been associated with 72 everyday activities such as sneezing, driving, and playing tennis. And during my lengthier talks on this, I go through those 72 associated activities because it's all in the medical literature. Arterial dissections occur in 3 to 4 out of every 100,000 people, whether they are receiving health care or not. Not about chiropractic care, it's whether they're receiving health care. Patients who experience this condition often, but not always, present to their medical doctor or their chiropractor with neck pain and headache. Well, what the heck do you do about that? How many people do we have coming to us with headaches or neck pain? Tons. But the research says there is no significant difference of an incident of somebody winding up in the emergency room with a dissection leading to stroke after seeing their chiropractor versus their medical doctor. So it's not about the adjustment. Unfortunately, a percentage of these patients will experience a stroke regardless. The reported association between chiropractic visits and stroke is so rare, we say it's exceedingly rare, and is estimated to be related in 1 in 1 million to 1 in 2 million cervical adjustments. And the attorneys wanted to put surgery stats as the comparison, but a patient wouldn't find that to be real. So we found that for comparison, the incidence of hospital admission attributed to just aspirin that people go down the corner and pick up nonstop day in and day out for major GI events of the entire upper and lower GI tract is 1,219 adverse effects per 1 million users every year. And the risk of death is 104 per 1 million users. And we're concerned about our adjustment. That's telling us that someone that goes and takes aspirin is 100 to 200 times more likely to die than someone wind up with a stroke that may be coincidental after seeing their chiropractor. I would say that we're in good shape in terms of our risk in the chiropractic world. So I just want to end by saying thank you for the opportunity. I want to tell you what's in our informed consent packet because I want to give it to you. We have how to implement in a little bit more detail the actual consent. In addition to that is the consent form that you can just put right into practice. And above and beyond that, as I said earlier, we have all of the research that's relevant to strokes in the chiropractic world. And we have done a phenomenal job at researching not just stroke and chiropractic, but actually how to defend our chiropractors if they're ever accused of causing a stroke. And I want you to be so professional and so nonchalant in being able to educate your patient if that should ever come up, that we put it all in one package for you. And I'm going to give it to you. All you have to do is text us. Text to 480-500-6574 and just type in, it's that simple. You'll be asked to put in your email address and name, and you'll get a link that you just click on, and it'll open up a PDF that you can download, email to yourself or whatever you need to do so that you have the whole packet ready to go for you, and it would be great to review with your staff as well. So I want to thank you for participating with us today, and I'll look forward to seeing you on our next class. Thank you.